I want to talk about the surgical complications. Surgical complications. Now, the best way you want to have anything told to you is when you have categorized it. So it can be early, intermediate, late. So early or immediate, you can say within 24 hours, something like that. Intermediate, just about that, around maybe 3 days, and late 3 to 5 days. So and late beyond that. So you can take on the long-term complications and put it into that. Now, uh, let's just say now this is an easy way just for you to remember close to maybe even 10, maybe 15, right? So as I'm telling you, I'm not really looking at anything. So close to 10, 15, you probably might be able to tell if you just follow this way of workup in your mind. So early, right? So when you are done the surgery, so post-surgical complications, this is what I'm talking about. So when you're done the surgery, right, immediately you can have some primary hemorrhage. That's, immediately you're having some kind of issue. Then there is something known as a reactionary hemorrhage, which again, the wound sometimes might have a little bit of oozing. This is again less than 24 hours. So there are two. Then you can talk about system wise, you can evaluate one of those things. System wise, you can evaluate. Right here, when you evaluate, you can think about your MI. You can think about atelectasis, where the lung is failing to expand. You can think about acute urinary retention. So that's one. You can think about nausea, vomiting. So those kind of things might be there. Even confusion, like general anesthesia. Sometimes the patient might be confused too much. So these are some of the early complications you might find. Even structural damage. That's also something you can talk about. So around here you get about 5 to 6. Then come towards intermediate. So now this is now you have finished your initial phase, and now you are coming to the intermediate. Now here, what you want to do is, even hematoma can come into the early one. Thyroid surgery hematoma might need urgent release of sutures, so that you don't experience desaturation and those things. So at those times you might take hematoma there in the early as well. So now come to the intermediate, something around like second, the 3 to 5 days. This is when you get a lot of your infections. A lot of your infections can come over here. So now what we can see is, so I talked about reactionary hemorrhage being in the first one. Now here you talk about secondary hemorrhage. Right? Greater than that, you just secondary hemorrhage, hematoma. So you can get about two around there. Now after that, you can put a lot of infections together here. Line sepsis, urinary tract infection, pneumonia. If you're doing some kind of, the patient is immobilized, pulmonary embolism, DVT, paralytic ileus. So these things, I think this again adds up to around 6 or 7. So now itself you might have around 12. Now you're not even looking at anything, right? That's the thing. Now come towards the, what is it? The light. Light again, just think generally, but if you have looked at patients, they would come to you naturally. But if you haven't, then you just will have to build up some experience till you can correlate those stuff. So now come towards light. So what are the things that you can remember here? Just think about the wound, right? You might have a surgical site infection, poor dehiscence. The wound might not be. These things, surgical site infections, poor dehiscence, they also come. They come there mainly in the, what is it? You can add that to the intermediate, right? Intermediate. Put that in the intermediate. So we got about 8 in the intermediate. Now come to the late. Late. Let's talk about the healing. Hypertrophic scar, keloid scar, adhesions, strictures. If you're something else, you can talk about fistulas and those things. Then orthopedic non-union, malunion, delayed union, deformities, um, those kind of things. So those things again. So you can see now, not really looking at stuff, just from recalling the scenarios, you can get close to 20, which I just did. So 20 post-surgical complications, laid down very simply, not a lot of thinking, everything easy.